Hi, everybody, and greetings from Cherry Hill, New Jersey, in the 3rd Congressional District, one of the very few in the country, where our congressman is digging in their heels, aligning with the president, and voting against the very popular S-CHIP program, which is designed to give health insurance to low to middle-income kids. Hard to believe. I don't even know where to begin. But to that end, State Senator John Adler, who also represents Cherry Hill and Trenton, and not incidentally is running against Jim Saxton for Congress next year, held a press conference and invited the governor and the speaker and all manner of policy wonks down to Cherry Hill to lean on Jim Saxton to vote to override this veto. The vote is tomorrow. Senator Adler chose the location of this morning's press conference, and it seems symbolic that the site was the pediatrician's office here in Cherry Hill, where he's been taking his kids since the oldest was born something like 18 years ago. Many prominent state politicians were on hand to lend their support. There's Speaker Roberts, Governor Corzine, Cherry Hill Mayor Bernie Platt there in the middle, as well as New Jersey Senator Ellen Karcher. And finally, there's Dr. Suze Hodgson, who's New Jersey's chief child advocate. When Governor Corzine got up to speak, he mentioned that he's repeatedly put in personal calls to Jim Saxton to change his mind. After all, Congressman Saxton's vote leaves over 3,000 children here in his own district, here in South Jersey, vulnerable. But I don't know, I could crunch numbers till I'm blue in the face. It's probably better to put a personal face on this. That's Lillian. Her mom, Deborah, is a small business owner down in South Jersey who couldn't afford the $500 monthly bill to keep her daughter on health insurance and enrolled Lillian in New Jersey Family Care. Now Lillian's covered, and the $150 a month is a manageable price tag for mom and dad. Remember, folks, S-CHIP is not for free. It's not a handout. It's more of a sliding scale for the average New Jerseyan who's been priced out of health care over the last 5 or 6 years. Marissa Palmer's from nearby Sicklerville, also in the 3rd District. Without S-CHIP, she and her sister Brianna wouldn't have coverage, and since they both suffer from asthma and their father died of respiratory complications, they're the perfect example of the kind of preventative care that SHIP is able to provide. We want them happy and healthy. Just look at her. Look at her. Look at that face. Not depending on emergency rooms for their primary care. It's penny wise and pound foolish, which is exactly what Dr. Hodgson said. She's New Jersey's chief child advocate.
If we don't pay now to provide the preventive coverage, as a clinician, I shudder to think at what charity care is going to do in the next year in New Jersey.
So these are the issues, child health care, that are really concerning progressive groups in New Jersey, such as New Jersey Citizen Action. They're chatting with the governor and local Assemblywoman Pam Lampett. Also on hand locally was Cherry Hill Mayor Bernie Platt, who had an interesting theory why Congressman Saxton continues to give his Camden County voters the shaft.
Why do you think he doesn't show Cherry Hill any love?
Well, I think, and I can't, this is a statement I heard from a third party, okay, but he said Cherry Hill's rich enough and they don't need money.
Ouch.
The last word goes to young Oliver Adler, seen there with his dad after the press conference was over. Leave it to a kid to put it all in perspective without statistics, spin, or any kind of blowharding.
Why do we want the S-CHIP, Oliver?
Because it's for health insurance for little kids.